With the winters here, Christmas approaching, New Year almost here, and the wedding season almost bearing upon us, we have some treatments that a lot of patients look forward to during these times. They have minimal downtime, not a lot of work that needs to be done, no admissions either. These are things like Botox, fillers, and threads that just need to come into our OPD. We do it and you go back home. So in this video, we'll be talking about these small tweaks that we can make with these non-surgical treatments and how they can help soar your confidence. Let's start off with Botox first, something that everyone has heard about. Whether you know someone or not, you've always heard the term Botox. It's always related to people looking fake and pulled up and plastic like. However, you would have noticed that in recent years, that look has sort of gone away. People don't really look fake these days. If it's there, it's a poorly done job. Botox basically is not used for the rest of the face like your cheeks and other areas. Where we use Botox is the forehead, the glabella, that is the center area between your eyebrows, the crow's feet. These are the most common areas where Botox is used, and it is used for decreasing the wrinkles that appear when you move your face, like the worry wrinkles, the frown wrinkles when you become angry, or sometimes if there is excessive wrinkling when you smile. Now you have to understand we are not going to remove or freeze your face so that there's no expression possible. You will still be able to move your eyebrows. You will still have some lines that happen when you move your eyebrows or when you smile so that your smile does not look fake. So yes, Botox can be a great thing. Some other things that Botox can help with are neck bands and maybe big masseters and some other minor corrections like the side of your mouth drooping. These are things that we can correct with Botox. Fillers, again something that has sort of gotten a bad rep in the market because they have been poorly done. It's not the problem of fillers that you have overfilled filled cheeks or big lips. That is the problem of the people injecting these fillers. If done well, if done in small quantities conservatively, fillers are a fabulous treatment that our patients love. It makes them feel younger, feel fresher, feel those small corrections and small blemishes go away. We think of fillers like an internal makeup. It's not going to change how you look, it just enhances it. We can do fillers for anything from your temple, your cheeks, your nasolabial lines, these lines which are called the marionette lines, for defining a jawline, for giving a better chin, and for a lot of other things. So yes, fillers are again a thing which you can do in the OPD, no downtime, and you can walk out immediately looking fresh and great. Tread lifts, something that a lot of people don't know about and sometimes are also very scared of because there are very few practitioners of these techniques of tread lifts that we do. There's a company called as Aptos whose threads we usually use, which is basically the inventor of threads. The threads we use are PLLA and CL threads, so they last for about a year. The companies say for about 2 years. I would say give and take a year or so. Anything about that is a bonus, is what I tell all my patients. We don't use PDO threads because they last for about anywhere between 2 to 3 months. We can use threads for lifting. These are subtle lifts and not like the facelift lifts. If you do that, that is not what we give you. These are subtle lifts. These will help with areas like your nasolabial folds, your jawline. It can also help with a little bit of a sagging neck. And all of these results last up to a year. You can also do your eyebrows, mind you, and also your nose. So these are the different things that threads can do. There are also something called as mono threads, which we hardly do. These are for skin rejuvenation, and they are like what you see when they are put like in many numbers. The threads that we do are what are called as barb threads that catch on to the undersurface of the skin and the fat under that and pull it up. So that's about thread lifts. So if you have any other questions regarding Botox fillers or threads, do comment below or you can visit us or give us a call and we'll be happy to help.